Welcome to all. The topic of today's discussion is radiological anatomy of abdomen. Before moving to the topic, we should see about what are the positions which is required for this type of radiological X-rays. Which is an ideal term, X-ray or radiograph? Radiograph is an ideal term. Okay, but commonly we use abdominal X-ray. In this class, I will use about the X-ray only, X-ray term only. The first X-ray is abdominal X-ray supine view. You can see in this picture, the patient is lying on the table and the X-ray machine which is passing the X-rays is kept above. Okay, so this is called a supine anteroposterior view of the abdomen. And here also we can see that we can have an upright view or erect view of the abdomen. So what is erect view? The patient is standing erect and we are taking the X-ray. That is called abdomen X-ray, erect view or upright view. This can be combined with an upright chest view also. We can see that this is an upright chest view where we have so upright chest view also can be combined along with the abdominal X-ray. Now, what do you see in an X-ray? So on the right side of the picture, you can see an abdominal X-ray. We'll talk about in the subsequent slides. So you can see that it is all or different grades of grayish. You cannot see a color here unless it is a text bar here. So most of them are dark in color and different shades of gray. So if it is black in color, what is it? The black will be the gas or air. Or air can be black in color. So you can see in this picture, inside the intestine, it is black in color, which is a gas. On the side also air is there. That will be why it is like this. Now, if the medium is passing the X-ray clearly, that means air is passing allowing the X-rays to pass clearly, easily, that will be dark in color. That is called radiolucency. And if it is not passing, it is called radio-opaque. So we have different shades of radiolucency and radio-opaque. So what is radio-opaque? If the medium or if the substance is not allowing the X-ray to pass through, it is called radio-opaque. Now in this picture, which is one which is black in color, the sides and the gas shadows, which is white in color. We can see the bones are white in color. So they are radio-opaque structure. If we have, imagine if you have a metal coin here, so it will be intense white in color. That will be intense white, that is a metal. Okay, so foreign body which can be, especially metals, will be intense white in color. So black is gas and air, dark gray is fat. So you can hear some dark gray shadows which are fat present in the superficial part of the abdomen. It can be light gray, which is soft tissue fluid. Inside the intestines, we have soft tissue fluid that will appear as light gray, and bone margins are appearing as, or bony calcifications can appear as white in color. Okay, so these are the things you should know. So what are the indications to take an abdominal X-ray? Why we need to take an abdominal X-ray? First indication is emergent evaluation of bowel gas. So if we have a case of an intestinal obstruction where we have obstructions of the intestine, that time we should know that where the bowel gas is normal or not. The term used is called air fluid levels. You will learn about in the clinics. So intestinal obstruction, for emergent evaluation of bowel gas is there or not, that time we will take an abdominal X-ray. The second indication is emergent evaluation of pneumoperitoneum. In anatomy, if you understand the terms, it is easy to understand the subject. So what is pneumoperitoneum? Pneumo means air, peritoneum means in the peritoneal cavity. Why we have air in the peritoneal cavity? If we have a gastrointestine, okay, if we have a perforation means what? It is a opening in the gastrointestinal tract. So the air inside the intestines will come out. That will be appearing in the peritoneum. The term used is called air under the diaphragm. It's called air under the diaphragm. It's also a clinical sign. So for the emergent evaluation of pneumoperitoneum, we are using abdominal X-ray. The third indication is assessment of opaque foreign bodies. Radio-opaque. What is radio-opaque? It is not allowing the X-ray to pass to the film. That is called radio-opaque foreign bodies, especially coins. Okay. Assessment of tubes and medical devices. So if we have a Ryle's tube, what is Ryle's tube? So we'll insert a tube through the mouth and it will be entering into the stomach. That is called a Ryle's tube. It will have a contrast material coated into this tube. So after you put the tube, we are taking an abdominal X-ray, whether it is exactly located in the stomach or which position of the stomach, that we can assess by means of an abdominal X-ray. Okay, so these are the indication for abdominal X-ray. In this slide, as soon as you get this slide, what is the thing you should say? So this is a plain X-ray of abdomen AP view. AP view is antero-posterior view. What is antero-posterior view? The X-rays are passing from anterior side and the film is kept posterior. This is called antero-posterior view. Now the patient is standing erect, that we have seen in the first slide, and the view is called antero-posterior view. Posterior structures are more visible. Why this? The structures which are nearby to the plate or the film is visible more when you compare it with the structures which are on the anterior aspect, especially the structures. So in an AP view, which are the structures which will be more? The posterior structures. What are the posterior structures? We have the vertebra, the body of the vertebra and the ribs that will be appearing more visible when compared with the anterior abdominal wall structures. Okay. So this is a plain X-ray of abdomen, antero-posterior view showing this. Now in this slide we can see the what are the things we will see in a plain X-ray of abdomen. First is the 11th rib. Okay. Always count the ribs from the lower part, don't count from above, it can mislead you. So we have a rib present here, that is the 12th rib. So above that this will be the 11th. So we have the 11th rib and 12th rib. And we have a black shadow that is called intestinal gas shadow. This is the term we should use, intestinal gas shadow, because they are different grades of gray. So we call it as intestinal gas shadow, the air present inside the intestine. We also see the lumbar vertebra. So this is the sacrum. Above that, this will be the L5, 4, 3, 2, 1. You can see on the 12th thoracic vertebra, the 12th rib is there. So this is probably the third lumbar vertebra. Below that you can see the sacrum. So these are the main features we can see in case of, we can also see a renal stone also. We'll see that in the renal studies picture. Okay, that also can be seen. So these are the main pictures you should see in the plain X-ray of abdomen antero-posterior. There's one more picture to show the same plain X-ray of abdomen. Here what are the things we can see? This is the 12th rib, this is the 11th rib and 10th, okay, lumbar vertebra, sacrum, and you can see occasional the intestinal gas shadows. What is this picture? This is a again a plain X-ray of abdomen, antero-posterior view and lateral view. Now this is a X-ray showing the lateral view of the lumbar vertebra and lateral view of the intestinal gas shadows and the ribs present on the upper aspect. You can see the lateral view of the sacrum also. The next picture, what is this picture? This is a plain X-ray of thorax and abdomen. Why? Especially in case of newborns, usually I told you that we can take the, in case of an ingested foreign body, you take a X-ray of abdomen along with the thorax we can take. As a single X-ray we can take. This is called a plain X-ray of thorax and abdomen. So all these are what? These are plain X-rays. Why we are saying plain? Because we are not taking any contrast material into the abdomen. These are the main components of plain X-ray of abdomen. In case of infants, they can take as a thoracic cavity and abdomen. You can see the intestinal gas shadows in the thorax also. Sorry, in the abdominal cavity. Okay, the next radiograph we are going to see is the contrast radiography. What is contrast radiography? What do you mean by contrast? We in the previous picture you must have seen that the radiographs we cannot able to say, we can say that intestinal gas shadow, but we cannot say whether it is stomach or small intestine or large intestine. Especially the small intestine, large intestine we cannot see. Stomach we cannot see at all. So if you want to evaluate the gastrointestinal system as such, we need to put a contrast material and then only we can say about the organs of the gastrointestinal tract. That is called contrast radiography. So previous X-rays are plain, this is a contrast radiography. So what is the contrast radiography? First, most of the contrast radiography are called barium studies. We have 4 different barium studies. First is a barium swallow, second is barium meal, third is barium meal follow through, fourth is barium enema. Now first picture we are going to see is the barium swallow. What is barium swallow? The barium sulfate, especially 50% barium sulfate is the contrast material which is used. It's come in a powdered form. If you have to dilute with water or milk and make it a concentration of 250 to 300 ml, and we ask the patient to swallow. As soon as the patient is swallowing, you are taking either an anteroposterior view or a lateral view of a neck region that is called barium swallow. This is usually done after post to 6 to 8 hours of fasting. Why? Always ask the question why to can understand each picture. Okay. What why? Because the gastrointestinal tract should be empty for us to take a contrast study of the GIT. Okay. So we usually ask the patient to have a overnight fasting, and then in the morning this procedure will be taken. Post 6 to 8 hours of fasting is required. As soon as the patient swallows, we'll take the picture of, or we'll take an X-ray picture. You can see here the patient is swallowing and then it is reaching the upper part of the oropharynx, or we can say this is the oral. From here it will call the esophagus. You can see the what you see in the barium swallow. We usually see the constrictions of the esophagus, and we will see any strictures, or if we will see any filling defect is there. The term we use is called filling defect. The contrast metal is not getting filled properly. It's called filling defect. So these are things you will see in case of esophagus. Esophagus normally has some constrictions. We should evaluate the constrictions. So what is the first study? Barium swallow. This is also one more picture to show the barium swallow. You can see the patient is swallowing, and then you can see the entire texture, entire contrast material is there in the esophagus. It is reaching up to the stomach. It starts getting filled in the stomach. This is a lateral view of the same picture, lateral view of the barium swallow. First study is called barium swallow to study the esophagus especially. The second study is called barium meal. In case of barium meal, actually we should say it as barium swallow, barium meal follow through, or single procedure. It is taken at certain intervals. We give a separate name. Okay. So barium meal is also the same 250 to 300 ml, 50% barium sulfate post 68 to 8 for fasting. When the contrast material is reaching the stomach, we will take a barium meal. We will take a picture. We call the picture as barium meal. Now, what you see in the stomach, as you must have seen in the intestine, inside the stomach we will have gastric rugae. This gastric rugae will appear like a radio opaque shadow. We can also see ulcers. If we have a gastric ulcer, it will appear like a crater. What is a crater? The volcano, top of a mountain volcano will be appearing like a crater. That's called a crater. No? Here also the filling defect of an ulcer will appear like a crater. What we see here is the number of rugae, shape of the stomach, the size of the stomach, whether the tone of the stomach is normal or decreased tone. These are the major things we have to visualize, or we have to look into in case of a barium meal. As a part of this, now after this you can see here, from this contrast metal has reached up to what? To the duodenum. It is reaching to the duodenum. Now when the emulsion is reaching the first part of duodenum, you can see a triangular shadow here, triangular white shadow. What is the triangular white shadow? That triangular white shadow is called duodenal cap. The commonly asked question, what is the duodenal cap? The triangular shadow present on the first part of duodenum with the base towards the pylorus and apex is pointing towards the second part of duodenum. This is called duodenal cap. And duodenal cap, why it is present? Because of the obliquity of the first part, the contrast metal is filling like a shadow, or the triangular shadow, that is called duodenal cap. Now, post normal barium meal, what will happen? The gastrocolic reflex will start. And what is gastrocolic reflex? As soon as you take a food, you will feel like it is reaching the. Some people have irritable bowel syndrome. That time it might reach the large intestine also. So that reflex, which is starting from the gastric region to the colon, is called gastrocolic reflex. Because of this gastrocolic reflex, the contrast metal is reaching the small intestine, and it can also reach the colon. Now, after 1.5 to 2 hours, what has happened? The gastric emptying. You can see in this picture, there is no stomach. We are not seeing any stomach at all. So now the contrast metal is entirely in the small intestine. That is called barium meal follow through. Now we give a separate name for this. This is called barium meal follow through. Follow through means what? The barium is, we are following the barium sulfate to the small intestine. That's called barium meal follow through. At what time it happens? 1.5 to 2 hours. The shadows of small intestine can be visible. Now the term we usually use is the feathery appearance of the small intestine. This is the term we will expect, that feathery appearance. Why we have feathery appearance? The feathery appearance, feathers of a bird. Okay, due to the circular folds. What are the circular folds are called? Plica circularis. So circular folds are present in the mucosa of the small intestine. That is why it is appearing as feathery in appearance. Now almost like 12 to 14 hours it reaches the large intestine. It will take 12 to 14 hours to reach the large intestine. It is usually evacuated in 2 to 3 days. So can we ask the patient to wait for 12 to 14 hours? We cannot ask the patient. So it is usually, but usually the barium sulfate, why we are using barium sulfate is because it's an inert substance. It usually doesn't cause any reaction into the intestinal, gastrointestinal area. That's why we use barium meal follow through. So what are the three terms we have seen till now? Barium swallow, barium meal follow through. Barium meal follow through is to evaluate the small intestine. Barium meal is to evaluate the stomach. Swallow is to evaluate the esophagus. So these are the three terms: swallow, meal, and follow through. Why it is still now we have seen all the white color. Why it is black in color? Because it's a DSA, digitally subtracted image through the computer. So we can we have a DSA image. So what you see here is the esophagus. This is also an esophagus. We can see the stomach here. After the part of the stomach, we can see the duodenal cap. Duodenal cap is not that much clear, but we can see this is the feathery appearance of the small intestine. So we can say this picture as two pictures as swallow, two pictures as barium meal, this as barium meal follow. These are enlarged image to show you the barium swallow. You can see the esophagus, and we can see some filling defect is there in the esophagus. But better to, we can say it as then we can say that this is the barium meal, and we can see this is the follow through. Here we can see clearly the feathery appearance of the small intestine, especially the jejunum and ileum. This is also barium meal follow through. There is one more picture to show you the barium meal follow through. Here also you can see the feathery appearance. Here you can see this circular folds and the filling defect is present as feathery appearance. This is a different picture to show the rugae. You can see that lines. Can you see the rugae here? So this is a rugae which is present in the stomach. So this is a swallow, meal, and this is a duodenal cap. Again, esophagus and the barium meal. Okay, this is also barium meal follow through. Here we can see the barium swallow, barium meal, and barium meal follow through. What is barium enema? As I told you that these three pictures, swallow, meal, and follow through, are a single procedure taken at different intervals of time. Now we cannot ask the patient to wait for 12 to 14 hours in the X-ray room to take to make the contrast material to reach the large intestine. It's not practically possible. So if we want to exclusively evaluate the large intestine, what we should do? We should take the barium contrast material into the large intestine. That is called enema. Anything passed through the anal canal is called enema. So the procedure is called barium enema. The emulsion is passed through the rectum. You put a catheter into the anal canal and you pass the emulsion into the rectum. It is taken within minutes. You have to take the picture within minutes. What is the characteristic feature of a large intestine? Ostrations and sacculation. So this ostration and sacculation of the large intestine is visible. The sigmoid colon will appear like a loop. You can see in this picture, this is the sigmoid colon. So this is a sigmoid colon which is appearing as a loop here, and this picture is also showing the sigmoid colon. And we can also see it is better done as fluoroscopy guidance. What is fluoroscopy? So if you take a X-ray or radiograph, if you take it as a real-time image, as soon as you are passing the contrast material and you are taking a series of X-rays, it's called fluoroscopy. So it's usually taken under as a fluoroscopy guidance. And so this is the S-shaped sigmoid colon. This is also the S-shaped sigmoid colon. So from the sigmoid colon, it will reach to the descending colon, then the transverse colon. So what you see here is the transverse colon. So this is the sigmoid, this is the left coliflexure, this is the transverse colon. This is also the transverse colon. So from the transverse colon, we can see the right coliflexure. So this is the ascending colon. Okay. So we'll go in the reverse direction. So this is the transverse. This is also the transverse colon. This is the right coliflexure and the ascending colon. Okay. So here we have seen barium swallow, meal, follow through, and barium enema. Now what are the indications for barium studies? To summarize, barium swallow is for identifying the esophagus and esophageal disorders like stricture of the esophagus, post acid burns or any poisoning. So that can be a stricture of the esophagus. There we can find the defects, the filling defects in the esophagus. What is barium meal used for? To identify the stomach ulcers, tumors appearing like filler defects in the, it's called crater-like defect. Okay. Barium meal follow through is to identify the small intestine disease like duodenal ulcers. Okay. Barium enema, why we need to do? We need to identify the large intestine disease like diverticulosis and carcinoma. In case of colonic carcinoma, the appearance is called apple core appearance. Here you can see this is the apple core appearance. What is apple core? Apple core means like only the core of the apple. So this is appearing like the filling defect is appearing like in apple core. That's why it's called apple core. So in this class, what we have seen is that we have gone through the plain and contrast studies of the gastrointestinal tract. Thank you.